Hello everyone. Uh, Welcome to the session about the FMG recall and the general overview about the examination. And I welcome respected faculty member Dr. Kaushal sir, our anatomy faculty, and Sandeep sir. Welcome to the session. And
Hello
we will
everyone.
be, welcome to the session about the FMG recall and the I'm
general
sorry,
overview about the examination.
why this sound? Okay, sorry. Guys, so we'll be letting other faculty members join one by one also to give you the subject related this thing. The first overview about this particular exam was it was moderate to moderately tough paper as far as the paper two is concerned. But paper one was a bit expected paper, and but yes, paper two had a lot of questions which were multi-liners and particularly like clinical subject questions. And we could, as of now, get the data from a lot of students that paper two had a situation which was more challenging for a majority of the people, and paper one was a little breather for those people who had done, previous year question based study out of the, basics and the paraclinicals. And I would request Dr. Sandeep Sharma sir to give his perspective about whatever he could gather from the students as of now. So you are mute, sir. You are mute.
Good evening, Rajesh sir. Good evening, Rajiv sir. Good evening, everyone, all the students. First of all, take a deep breath. Whatever had to be done has been done. End of the day, the one thing which is constant is examiner changing the pattern certainly every year. Now we can fully clearly see that the pattern has evolved. There are virtually no one-liners. There are virtually no one-liners. This is the feedback. Whatever I'm saying, I'm not sitting in the exam. I'm sitting comfortably at home with the heater on. Whatever I'm saying is based upon the inputs you people have given, and it's not just one, two, or three people. It is based upon multiple inputs we have got on Telegram, Instagram, as well as our YouTube channels and Facebook groups. So the overall pattern is paper one was relatively easier compared to paper number two. Moderate paper number two, moderate to tougher side. Paper number one was moderate. Paper two was moderate to tough. Paper two especially had 7 to 8 questions at least, probably more than 10, where clinical scenarios had 4, 5, 6 line statements. Lot of image-based questions, and even simple questions had a lot of images added to them. So many times image was adding to the information, many times it was just there, but a lot of image-based questions were there. There was a lot of overlap. You had chest X-ray images and a one pediatric question coming in paper one, and you had other things coming in paper number two as well. And we have been joined by Priyansh sir. So talking about my subject, that is pediatrics. Pediatrics was atypical and on the tougher side this time. I was telling in my classes also, the jinx has to be broken, and it has been broken. Pediatrics was coming too easy, but again, at the same time, it was not unsolvable. There was a very tough question on asymmetric tonic neck reflex. For those who are interested in knowing, similar question was asked in Super Speciality 2022. They asked the same question in FMG exam. So it is cruel for FMG's aspirants, number one. Number two, there was more weightage of neonatology compared to general pediatrics. But there were some breathers like Apgar score, measles question. There were some congenital heart disease, hypothyroidism question, and TOF is always there. It was there this time as well. So overall, pediatrics was on the tougher side. Moving over to Priyansh sir. Priyansh sir, your views
Yes.
about the exam, as well as
Okay.
please tell about biochemistry and also a few words about medicine, sir.
Whatever I have got, the information, the paper was very difficult and should not be like this. It's not at any time, it was not at the level of uh, the screening exam, but the only subject that was I found among the student easy was, I don't know why, but it was only biochem where there were few one-liners were there. That was in the first half, first block. बाकी पूरे पेपर में कहीं पे कोई वन लाइनर नहीं थे कुछ नहीं थे और it was I feel is a tough paper sir.
Rajesh sir. Sir,
Yeah, yeah,
your views about
definitely. Yeah, papers. Uh, uh, Dr. Rajesh Kaushal, sir, any input to you for the anatomy part, sir, in the paper one, because people were hopeful. So please, on your mic, sir. Switch on your mic, please.
So,
Yes. So again, you yeah, mute, sir.
yeah,
Yes. Yeah.
good evening. Good evening to you all, Dr. Sandeep, Dr. Rajiv, Dr. Priyansh. Dr. JP is also there, I believe. So, as far as anatomy goes, what I am seeing is questions which are with me. They are mostly image-based questions, and I'm hopeful. Like if the students have prepared well, say for example, interventricular artery, they have marked surgical neck of humerus with that axillary nerve injury, anterior cruciate ligament, psoas major muscle, palmar interossei. What I see is some of the questions which come in PG level also, they keep asking in FMG, which we keep telling students that you have to prepare previous year questions of even NEET PG, INS, CET. So I'm hopeful that around 60 to 70% questions they should have been marked correctly by the students because they are usual questions. But then it is easy for me to say when it comes to the students, things are slightly different. But there are some questions like submental triangle, maybe we don't focus too much. So we will be talking more about digastric triangle, so that is submandibular. And then question on ansa cervicalis, we teach in PG, not in your FMG. So as Dr. Priyansh is telling, even Dr. Sandeep has mentioned, the questions are coming even from super specialty level. So there's one question, mandibular foramen. So we keep discussing all these things, but more in PG rather than in FMG. But FMG also, if you ask me, around 70 to 80% questions are actually from the classes which we are doing. So maybe I was a little bit lucky in that sense that anatomy, according to me, was scoring. But I'm not very sure. Let me just ask the students also because they are the real judge. Over to
Students who
you.
have joined the session, yeah, they whatever whichever students are there, we'll be very happy to have your inputs in the comments. And in the meantime, I'll just give you a brief overview what ENT was all about. And again, when the clinical subjects are being asked in the like two-liner, three-liner, four-liner, multi-liners, I think the paper has been showing a very good trend in the last three sessions that paper is moving toward the clinical vignette based style, and particularly paper 2. But paper 1 also had couple of these kind of things. But as Priyansh has said, Sandeep has said, the papers are always difficult. Somehow I feel that this is a general feeling within me that no paper is easy paper. I have now not met people who will come out of the hall and they say paper is easy. But at the end of the day, always keep in mind, 150 out of 300 without negative marking. I think a lot of students will be able to make it. Let me read out the topics asked in ENT, and I think if you have attended the, the ENT live lectures and all, I think you'll be able to relate to a lot of them. For example, they asked about rhinocleroma this time, which was really a good topic to ask. They went to the ring edema image also. Ring edema image-based diagnosis was asked, and I think again this was something they had asked earlier. And they went into omega shift epiglottis once again, laryngomalacia, image-based question. They asked all three topics, in fact, this time. They asked audiogram also, tympanogram also, and tuning fork tests also. I think, as we always say, the audiology is having a lot of weightage. So they went into all the three domains over there, tympanometry, one image-based question, again, noise-induced hearing loss, image-based question, and then they asked about the one tympanogram, and they asked, I think, whatever I could get it from people, they only asked you to identify what type of investigation has been done in the given picture above. So one of the question which was, I think, it was there in our MIQ, very first question was there probably, if after thyroid surgery patient is unable to sing a song properly, which nerve could have been damaged? And I think we discussed ample number of time, it was superior laryngeal nerve which was damaged, and that was the choice over there also. Again, like if you know the ENT lectures, bat ear, the any cosmetic surgery of pinna should be done after 6 years of age, because by that time pinna attains adult size. Again, an expected beautiful topic, coming first time in the NEET in the FMG segment, but it has been there in the your classes, your video lectures, in fact your QRP videos as well, it is there. And something about tonsil came this time. I'm not sure about the image, but it means that image based question were pretty dominant this time. So like tympanometry images, then audiometry images, then omega shift epiglottis image, ring edema, and people are saying two images around tonsil were there. Palatine tonsil was asked over there. What question it was, I do not have the exact thing. And These are the preliminaries, but if you see the multi-statement based question of the clinical subjects, definitely give us scare. But how to have a like overall assessment in a holistic manner is collectively out of six domains, six different modules, we have to pass the paper. So if you look at the paper one, whatever prior information, earlier information we have right now, a lot of people would have scored, like Priyansh is saying, biochemistry went well for them. Collectively, in the first three modules of the paper one, they would have made significant contribution to the 150 required score over there. And in the paper two, as we always say in the class also, the statement based question, when you think beyond notes and think for the more common diagnosis, you are able to reach not on all of them but majority of them. But since they were like 7-liner, 8-liner also, so we can expect that people would not have finished reading the question, and that creates panic. So but do not really start anticipating anything. Do not really say that okay, like we have lost it, this like that. But as the days will progress, and soon our faculty members would be coming up with one by one recall also. So you will have a very, like clear-cut assessment, though there is an error of recall possibility, but you will get assessment about various subjects as well. So the recall session will go on from today till tomorrow. Why we are extending it to tomorrow as well? The reason is we want to really be sure what we are presenting to you. Certain faculty members would be doing it today, but on the same channel we'll be doing the other subject sessions as well, as faculty is getting more inputs the choices also, because we want to give you a very as clear picture as possible about the examination. So we as a channel, as a platform, will not be in a hurry to do all the subjects tonight only, because that create, I think, too much panic also, because we don't have choices, we don't have the exact information. So we'd like to spend some more time on collecting the data before we present to you. Again, there'll be error of recall, we do understand, but we want to be as close to the reality of the paper as possible. Sandeep sir.
Absolutely, sir. I think we have been joined by, before I start talking about pediatrics, I think we have been joined by Gayatri ma'am and Palvi ma'am. First of all, I'll finish off my thing so that others can take over. Like coming to pediatrics, the list that I have got, pediatrics, what was the change this time? Number one, the number of one-liners and easy things have been reduced by the examiner. Number two, the questions which were asked this time, normally in FMG exam, they have the weightage is something like maximum question from general pedia, followed by systemic, followed by neonatology. This time it was neonatology, followed by systemic, followed by general pediatrics. So what it means is they changed. So if somebody has done only kwashiorkor, marasmus, malnutrition, and not done the neonatology part, the person would be in a soup. But at the same time, neonatal respiratory distress, there were two questions. APGAR score, simple calculation was there, but you had to remember it precisely. There was a question on congenital hypothyroidism, again, neonatology question. Then there were no pneumonia and diarrhea questions, which was atypical, which makes the paper a bit tough. Why tough? Because topics which are traditionally asked every year, this time they shifted the pivot a bit. Were they from the notes? Yes. Have they been discussed in the class? Yes. But do all the students focus on them in the last weeks before the exam? Not everyone does. And that is what makes these questions, this paper number two, a bit on the tougher side. At the same time, even in medicine and also in a few questions of pediatrics, there was a lot of integration happening. Like they were talking about the question and then they were not asking you the diagnosis. They were mentioning the diagnosis in the question itself. And then they were asking you, what is the murmur? What is the treatment? What next needs to be done? Those kind of questions. Uh, for those who are listening to this and those juniors who are listening to this, my advice to you, as I keep saying, exams are evolving, papers are becoming tough, and the days of one-liners, days of only doing rapid revisions and quick revisions and sitting in the exam and cracking the exam, those are gone. At the same time, there are some, green areas, the oasis as well in the desert. There were some topics, some areas which were expected, which were predictable. From what students have said, that OBG was on the easier side, it was on the expected side. A few topics, a few systems like biochemistry was on the easier side. Physiology was relatively less, but no boomers, no bouncers were coming in physiology. Talking about physiology, we have been joined by Naveen Porwal sir. So I hand it over to Naveen sir to talk about the physiology perspective.
Yeah, good evening,
Naveen
sir.
sir, good evening.
Yeah, good evening, sir. I hope everything is good here. So actually, we can see here again, as told by you, sir, that most of the questions were integrated. Even this time, they've asked a lot of questions from metabolic alkalosis, metabolic acidosis. So many ABGs were given this time. So we can say these are common questions from, we can say, physio, biochem, medicine, all. So, and also there were questions from, a lot of questions from thyroid. So they have given a match the following type of question where we have to match about the Hashimoto, thyroiditis or Graves' disease. So they have given the antibodies. So the topics are very, they are very clinical topics in the physiology also. Again, one question from high altitude sickness. So this question was integrated with the pharma. They asked which diuretic is given. So as we know, acetazolamide is the drug of choice for high altitude sickness. So they have given the option like pyrazinamide, acetazolamide. So these are very conceptual. They are not one-liner. Okay. And one question was direct physiology question where they have given the action potential diagram and they asked that repolarization is because of which ion and channel. So 3-4 questions I can say that they are very direct. They are from action potential, they were from RMP, but most of the question like the type of breathing, they have given the pattern, and apnea was followed by the crescendo and descendo pattern. So as we know, whenever there's a crescendo and descendo pattern, there is chain stroke breathing. So the options were like that: biot breathing, chain stroke breathing, small breathing. So the options were like that. So basically, they are touching upon the core concept. You can say they are from physio, you can say they are from medicine, but what they want to understand is that what we understand we that they're not one-liner. We cannot mug up the previous year paper and we can clear FMG. No, this is not possible. Again, a whole emphasis on the concept. Again and again, they are proving it. And again, one question from this that there is a injury on the superior temporal gyrus. So they ask which aphasia it can be, Wernicke's aphasia or Broca's aphasia. So as we know that superior temporal is a Wernicke's area, so comprehension will be lost. So it will be a Wernicke's aphasia answer will be Wernicke's aphasia. DMD question was there, Duchenne muscular dystrophy, how to differentiate it from Baker muscular dystrophy. And one diagram was given where you have to, say that this is iron deficiency anemia or megaloblastic. So one slide was given. So nowadays there is focus on the hematology lab also. Last time they have given Newar chamber and they asked what is that called as. This time they have given a slide and they want you to ask, you to diagnose the case that is it iron deficiency or is it a megablastic anemia. So they are touching upon the concept that do you know about this or not. So I think again and again we are focusing more on the integration. We are focusing more on the concepts part. I think one question was from Barter also. They have asked about the NKCC channel. So Barter syndrome is again integrated with the pediatrics, we can say, also with the pharmacology because loop diuretic is acting on the same NKCC channel. So if this is for the juniors who are going to appear in the next examination, that how you will advise them to prepare for FMG, I think you have to counsel them that they should put more and more emphasis on the concept part and the revision part. Because you can see that same topics they are asking again and again. They are not changing the topics. So if we can 100% confident in those 50% of the topic, no need to read whole Ganong, whole Harrison, whole Robbins. It is a qualifying exam. It is just a qualifying exam. So the main thing is that you have to take control of your nerves, the confidence level, the concept. So with the concept, clarity will come, and with the clarity, confidence will come. So there is no shortcut for the confidence. It cannot be pseudo confidence. So it is all based on the confidence. It is all based on the concept and the clarity, and automatically we start getting the confidence.
Thank you so much, sir, for your advice. We are also joined by Palvi ma'am and Gayatri ma'am. So one of the two can share their opinion about the exam, how their subject went like. Hello, ma'am. Good evening.
Hello, sir. Good evening, sir. So, as you rightly pointed out, sir, this time FMGE was much doable. Students were telling that majority of the things were from the notes. They were able to do it. It was not very rare areas or very difficult topic, but most of the common areas given in a slightly different format. That's it. This time the exam was more of that image-based questions from FMGE diagnosis-based, and even they asked the next step of management. I got nearly 26 questions till now from FMGE. Still, students are sending this. Mostly, if we compare obstetrics and gynecology, more weightage was there from gynecology this time. Usually, we get more weightage from obstetrics. This time, gynae had a good chunk of questions, especially from the contraception aspect, the malignancies, AUB, all this had good coverage. In obs and gyn, if I say the early pregnancy complication, like ectopic pregnancy, molar pregnancy, there were nearly 3 questions just from molar pregnancy. Pregnancy complications like twins, there were 2 questions, and labor intrapartum. So total 26 questions were there. If we just go through the breakdown of the questions, from labor, they asked about occipito posterior, the active phase, and CTG, late deceleration was an image-based question. And they commonly asked this. This was a repeat question, I would say. Previously, they had asked the variable deceleration. This time, they asked late deceleration. So those same areas are getting repeated. So again, I would say if you're someone who is preparing for the next exam, always focus on those previous year topics, not exactly the question, those topics, those are getting frequently repeated in this exam, especially not only the FMG exam, even the NEET PG, INI recent questions. It was heavily that PYT based questions were this time as well. From multiple pregnancy, there were 2 questions, and 2 of them were image based question as such. They gave this internal pedalic version, image was there, and twin pregnancy lambda sign was shown in the images as well. From contraception, we nearly got 4 questions. This time, heavy weightage was there from contraception. IUCD, patient with bleeding, which was a recent repeat FMG question itself from the past 2 years. Pearl index calculation was asked about contraception, which is contraindicated with hypertension. Sterilization method, that is modified Pomeroy, was asked. As we discussed, the early pregnancy complication were asked in detail, like ectopic pregnancy about methotrexate, molar pregnancy about ultrasound, as well as follow up with HCG. And even they had given a scenario-based question on cervical incompetence. This too was an image-based question that showed the image of cervix with funneling, which was again pointing towards cervical incompetence. From gynae, the bleeding related disorders, there was 1 question on AUB, as well as 1 question from postmenopausal bleeding. From gynae onco, this time, surprisingly, we didn't get any questions. At least till now, I didn't get any questions from CA ovary. But as expected, there was question from CA cervix. That is especially screening. Pap smear abnormality was given. Endometrial cancer specimen was given. Even endometrial polyp hysteroscopic image was given in the question. PCOD, the classical string of pearl appearance, was asked this time. Adenomyosis, again, they had this classical image-based question. The bulky uterus with all those diffusely enlarged globular uterus, endometriosis, and much predicted the Chadwick sign. And again, that is also a very recent question. They had asked Chadwick sign, murmur in pregnancy, and something common like papaya use in pregnancy was also asked this time. And from the physiological changes, they just asked about the cardiovascular changes, the murmur, which is normally seen in pregnancy. So overall, the exam was not very difficult. It was not very much theoretical. They asked either the next step management or they focused on these image-based questions. For students who are appearing next time, focus on these core areas, and especially the image-based question, the management aspect of this, all of these things are getting repeatedly asked. Focus on those important topics as such. And for students who have already written the exam, don't overthink about the answers. Just relax, breathe today. You have done your very best. Yes, I'm rooting for you to get a very good score. All the best.
Thank you so much, ma'am, for the brilliant insight. And now we are joined by Dr. Pallavi. Pallavi, ma'am, how was Dharma? Your views, initial insights about the topic.
Sir, I have received close to 12 questions in dermatology, which is a decent number. And I want to tell all of you out there, the students there, I hope you got these questions correct. All of these were very expected, very important topics. Nothing I've seen out of the book till now. And in fact, out of the 12 questions that I've received, each of them is an expected question. Only difference was that about syphilis, they mentioned it as a painless genital ulcer in the oral cavity. So that was the only one which was a little out of ordinary, but overall a very decent dermatology paper, I would say. As expected, out of 12, 7 questions on infections. I always tell the students that infections form the majority of the questions in derma because they can integrate it with micro, with pathology, with community medicine in terms of STIs. So very expected, very happy also to mention that out of these 12 questions, 5 of them were in the MIQs. Directly, those questions were there in the MIQs. The other infections were also discussed along with the questions in the MIQ. So I would say that's a very, very nice thing. I'm very happy that I hope all of you who attended the MIQ session got it correct. For all of those who are preparing, please focus on the important topics. They have not strayed beyond that this time, as you can see in the other subjects as well. Very straightforward, very clinical questions, focusing on diagnosis and management. Syphilis, chancroid, lymphogranuloma venereum, varicella, you know that they will be asked. Varicella, every alternate exam they asked this time as well. A leprosy reaction question was there last time also. It is there this time also. Madura foot management, which is mycetoma, every exam it's asked. Every exam. This time, just instead of asking the diagnosis, they went to the management. So, yes, you have to know the whole topic. Scabies was there in 2024 paper. It was asked this time. Lichen planus there in almost every other paper. Atopic dermatitis, same question as was there in the MIQ asked. Erythema multiforme, same question as the MIQ. Leprosy reaction, same as the MIQ. And so was the question on pyoderma gangrenosum, which was also in the MIQ. And sir, one more point I'll tell you, when I was making the MIQ paper for all of you out there also, a very important point of reference for me was the recent INI November 25 paper, because as you see across all the FMG papers, you might have noticed that the questions in the INI and the FMG are similar to each other. And even in this paper, there were a lot of questions which were around the INI November 25 topics. So for all of you preparing for the exam in the middle of the year, please make sure that you see the INI paper. That is a very important paper to be as a point of reference for you, at least for the important topics. That's all I would say. A decent paper. I hope you all got it correct. All the best. Any other questions that I might have missed? Please put them down in the chat. We will be coming up with a proper recall tomorrow with options if you have them. I'll be handing over to JP sir. He will be discussing the forensic paper with you. All the best for your result.
Okay. Thank you very much, Pallavi. As of now, I have not got much questions from FMT. I got about 5 questions. What I say is, any reasonably good student who studied during his MBS time, and especially who has gone through our videos, definitely can answer almost everything. The standard wise, what I say is, the standard is similar to NEET PG. I don't find any difference between FMG questions and NEET PG questions nowadays. So what I feel is, in future, in forensic medicine especially, except few sections in our law, like Bharatiya Nyaya Samhita, Nagarika Suraksha Samhita, all other questions, whether it is from toxicology or any other general forensic medicine, questions are similar. So even in my videos also, I cut down only some sections of Indian law to FMG. Otherwise, the teaching is almost same. But NEET initiate level questions will not be asked in FMG. That's all. And in my case, what 5 questions as of now I got. All are what you can answer by using your common sense. That's all. Wish all the best.
So, as we have already announced, the grand recall will be starting 11:30 a.m. onwards. That will be a detailed recall. We'll have most of the questions with us with the options available. And I think at the moment, Dr. Vandana should be joining us for pathology. We are waiting for her. Otherwise, as far as the journal overview, most of the faculty, they have mentioned that the questions, they are actually coming from the previous topics. Only thing is that The examiner is taking into account even the NEET PG questions, even NICT questions, even like I mentioned in anatomy, image-based questions which used to come in INICT, now they are all over FMGE. So I think Vandana madam is not available at the moment. That will be all for this session. And as we are informing you, 11:30 onwards tomorrow, we'll be taking a detailed recall. All the best for your results. We are hopeful that whatever you have performed is going to take you beyond 150, though it's always my insight is that you should always be preparing for 250 beyond. But even if you reach 150 beyond, that is what you are targeting for at the moment. And all the best. God bless. Take care. Bye-bye. V for victory.
Okay. Okay. So, hi guys. Yeah. So, I hope you all have done your exam well. So, the first thing which makes me happy today is the first question that I posted in the Jinx yesterday came in the exam. That is your crumpled tissue paper. The second was ITP, which again I posted yesterday. It came in the exam. A lot of hematology and a lot of image-based questions, which we will discuss in detail tomorrow. But for now, I think there was a lot of previous year questions and a lot of images. So pathology, I think I'm able to gather nearly 28 questions from pathology till now, and there are more to go. But a lot of the questions were, many image-based questions were there. They were not very tough, but they were conceptual, like nerve sheath tumor question marker came, which was S100, or Hutchison progeria history came, which was the mutation was LMNA, or the PNH, which is a complementopathy, its treatment came. The ITP case-based question came. There were a lot of images like your Hodgkin's, teardrop cells, or your target cells, seminoma, falciparum, Howell-Jolly body, neuroendocrine tumor marker, Marfan's, wedge biopsy from the tongue, schwannoma, hypersensitivity reaction, transfusion reaction. This was also a Jinx question which I posted yesterday. And then there were a lot of acute myeloid leukemia, chronic myeloid leukemia. So a lot of hematology came. About 2/3 of the paper in pathology was hematology. And then there was systemic pathology, very less general pathology questions came, but nevertheless, I'm sure you would have done great. Now it's the time to relax, and we'll be discussing the detailed questions tomorrow. Till now, till then, have a good sleep, and I'm sure you all will come out in flying colors. Right, guys? With that, bye-bye.